Hi, I'm Jonny Benjamin. I was 20 years old when I was sectioned under the Mental Health Act. I've been talking with Dr. Ranj Singh to find out what getting sectioned actually means. Let's talk about getting sectioned. What does it mean to be sectioned under the Mental Health Act?
Oh, sectioning is just such a scary word, and all it basically refers to is a paragraph in the Mental Health Act, and that's a reason that could be used to detain you for either assessment or treatment. It's really vital to remember that sections are used as a last resort, either because you need treatment and you cannot consent to it or won't consent to it because you might be too unwell at the time, or because you're at risk of harm to yourself or to somebody else, or because you need something in an emergency. And the important thing to remember is that it might save your life. That's what sections are there. They're as a backup, and they're used as a last resort when all the other options have failed.
And are there different types of section?
There are lots of different types of section actually, and it's quite confusing. And even as professionals, I think it can be quite difficult to navigate through all the different types. But they all have one aim. The idea is to either put you into a place of safety, either get you to somewhere where you can be assessed, or get you to somewhere where you can be assessed and treated. And the most common types are things like a section 2, which is somewhere so you can get to somewhere and get an assessment done, and that usually lasts for about 28 days. Something called a section 3 is to get somewhere, get assessed and get treated, and that tends to last for 6 months. And there's lots of other kinds of emergency sections as well, such as a section 4, and that might be just to get you somewhere, to get you into a place of safety. Again, they're there as a backup when other options have failed.
Talk me through the process of being sectioned. A lot of people have this image where men in white coats come along, they put you in a straitjacket, drag you away, but that's not the case, is it?
Fortunately, it's nothing like that at all. What happens is someone who's worried about you and is involved in your care, that might be your GP or that might be a mental health worker or a psychiatrist, initiates a section when they're concerned that things have got to that point. And then usually, 1, 2 or 3 people will come and do what we call a Mental Health Act assessment. All right, so that's when they explain to you why you might be being considered for a section, the reasoning for it, and what's going to happen. Okay, and then at that point, a plan is made, and you're usually taken to a place where you can get the help that you need. It doesn't involve, tying you up and bundling you into the back of a van. It's nothing like that. It's purely about getting you to a place where you can get the support that you'll usually desperately need at that point.
And where are you often taken once you've been sectioned?
It could be a number of places. So they might take you to a hospital, or they might take you to a specific psychiatric unit. They might take you to a clinic, or they might take you to just a place of safety, or even an A&E. Wherever is required to get that help that you need, that's where you'll go, and then you might go from there to somewhere else. Likewise, you might start off on one type of section, and you might be moved to a different kind of section later, depending on what your needs are.
And can you get yourself unsectioned?
It's a tricky process. You don't have to agree with being sectioned, but remember, at the time that it's happening, you might not necessarily completely understand what is going on because you're unwell. It's important to talk to your team about it if you don't agree. So when the Mental Health Act assessment is being done, it's a good idea to have a chat with the team that's doing it and say, well, what's going on? This is my view, this is my concerns, and this is why I don't agree with it. Now, it's probably not going to change things in that the initial parts of it. The outcome might still be the same, but you still have a voice, you still have a right to speak up. So when you go to your place of assessment or treatment, you might want to speak to your mental health doctor or one of your mental health team and voice your opinions. You can ask about something called an independent mental health advocate, who is someone who is specifically there to hear your views and to speak on your behalf. You might also want to think about a mental health tribunal if you've completely disagree with the way you're being treated. So there's lots of options available to you, but it's important to speak up if you feel that way.